Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I'll be taking a topic on acne. What is acne, what are the types of acne and what we can do to prevent acne. So let's start. So let me start with this topic, what is acne? Acne is a very common condition that all of you skin condition which is called pimples, and with common name like pimple is very common, which people are aware of. But what is acne? Acne is a condition where the open pores of your face get blocked. In the face there are many sweat glands which secretes sweat, which create oil, and these oil secretions they get trapped in the pores of the face. When this oil get trapped in the pores of the face, they form what is known as acne or pimples. Now there are various conditions depending whether this oil which is blocked in the pores, if it get infected by the bacteria, it become inflammatory acne. If it doesn't get infected with the bacteria, it remain closed, it becomes whitehead. Or if it opens up, it get oxidized, it becomes blackheads. So different names and types depending how and what happens to the oil which is trapped inside the holes. That is what is called acne. Now let me come to the types of acne. What are the various types of acne? Acne can be divided into two types, inflammatory and non-inflammatory acne. Non-inflammatory acne is commonly whiteheads and blackheads. Inflammatory acne can be pustules, papules, cysts and nodules. So these are the inflammatory acne, what we call inflammatory acne. Let me tell something about this inflammatory and non-inflammatory acne. Coming to what is a non-inflammatory acne, as I said, whitehead and blackhead are very common. We have seen with a lot of youngsters having these, and what are they and what happen. As I said, acne is because the oil which is secreted by the sweat glands, this oil gets blocked in the open pores. Now, when this oil is trapped in these open pores and it is covered, it is not coming in touch with the air, it forms the whiteheads. But if this oil which is trapped gets in touch with the air and it gets oxidized, it becomes black in color, which means it becomes blackhead. So whitehead and blackhead, only difference is in the whitehead, it is blocked, covered by some tissues. So the oil is not coming in touch with the air. In blackhead, the oil is in touch with the air and get oxidized and black in color. Now coming to the inflammatory acne, it can be papule, which is red in color, which is raised red in color, pustule, which is filled up with the pus, and they are inflammatory. There is a lot of redness, there is pain, there is pus. Then there is something called nodules. Nodules are like bumps that are raised, and cysts, which are called the which are like the cysts which are filled with some fluid, which is mostly pus. So depending on the types of inflammatory acne, the different names are given. Now the inflammatory acne will leave a very bad scar compared to non-inflammatory acne. And non-inflammatory acne like whitehead and blackhead usually do not leave much bad scars, so they are not that they do not cause long-term complications. Compared to that, inflammatory acne will cause a lot of complications. Similarly, we divide acne into mild acne, moderate acne and severe acne. In the severe acne, the inflammatory acne is much more, and in the mild acne, the inflammatory acne is almost absent, and we either have whitehead and blackhead. And in moderate acne, we have combination of inflammatory and non-inflammatory acne, both. That means the combination of blackhead, whitehead, pustules, papules, nodules, everything is there inside the inflammatory acne, mildly inflammatory acne. So this is a very common thing, people suddenly start developing acne. What causes sudden acne? So let me come to the common causes of acne. See, acne is dependent a lot on hormones. So whenever young children reach puberty, we start have a lot of acne coming. So because hormones do shift in puberty. Similarly in pregnancy, the hormones do shift. So anything which causes shift of the hormones, this acne can form. Now people taking any anabolic steroids or any other medicines which shift their hormones, they can have bursts of acne. Especially people going to gym, they take anabolic steroids, they can have a lot of acne coming up. So hormones is the one major reason that we know the acne is linked with. Another reason by which the acne will start suddenly developing is because of the diet, and especially high carbohydrate diet, rich in cold drinks, very sweet things, which are very rich in sugar, they can increase your acne. So this is well-known thing. Whey protein is known to cause acne. So refined sugars are known to cause acne. The dietary factors are there to cause acne. Then dandruff. Dandruff is sometimes linked with the acne. Somebody having seborrheic dermatitis or severe dandruff, they can develop acne very, very commonly, and the acne can be the reason for developing. Then some conditions are linked with acne. We have seen acne is very much linked with the PCOD, polycystic ovarian disease. It's very common in the polycystic ovarian disease. Some non-endocrine disease like Behçet syndrome, like pyogenic arthritis, these diseases also linked with a lot of acne formation there. So many diseases, endocrine, non-endocrine, can also be linked with increased acne formation that can be there. Then some medications can cause acne, something like lithium. If you take lithium as antidepressant, it can cause acne. Then oral contraceptives sometimes can cause acne. Then taking up of some other medications like bromine medicines, they can cause increased acne. So many medications can increase the acne formation. So this is something we have to keep in mind. Psychological stress can sometimes lead to acute acne, because stress sometimes changes your hormones and it shifts your sugar profile, blood sugar profile. All this can increase the formation of acne. So stress can also be one of the reasons for acne. Disturbed sleep patterns can also cause acne. These are various factors of acne that we know that can precipitate sudden bursts of acne coming up in the patient. So the question comes, where does the acne appear in the body? Commonly we think face is the area where the acne develops. But that's not true. It's not only the face and forehead where the acne develops. Acne is very common in the chest also and in the back also, and this is sometimes often missed by many patients, and sometimes the general practitioners also know this, that truncal acne is a very well known thing, especially in the bodybuilders and people taking steroids and with a lot of hormones. It's very common to get acne on back and on the chest also, besides getting it on the face. So these are the areas where acne is very common: chest, upper back, face, forehead. So we have to look for these areas for the acne. So coming to now prevention of acne. How can we prevent acne? There are various things we can do in the lifestyle management to prevent acne, and some routine things that we can do about the acne. As we know, acne is because of the blocked pores. So frequently washing your face is very, very important. Use some good face wash, especially salicylic acid face wash, tea tree face wash, that can keep the face clean and also remove debris and the skin cells from outside. It's very helpful. The second, avoid weight gain, because weight gain itself causes acne. Avoid sugars and sweet things, because we know that sugars and sweet refined sugars increase the formation of acne. Avoid stress and proper sleep patterns, that are very, very important. And diet is important, as we discussed. So taking high protein diet, healthy proteins, oils, and good amount of fruits and green vegetables would be very, very important to prevent acne and to keep acne in the right condition. So home remedies. What are the common home remedies that we can use for acne? So what I can suggest is one is a common thing, that we have been using from a long time, like tea tree oil. Tea tree oil is a very good thing for acne. We know it is antibacterial. You can use tea tree oil as a face wash, or you can use it on the face and apply it on the face. Another thing is which we see, apple cider vinegar, which is very good to cleanse the face and exfoliate the skin. That can be used, diluting in the water, and in a dilute form we can use apple cider vinegar on the acne. Then honey and cinnamon combination can be used as a paste on the face. That can be a very good thing for the use of acne. Aloe vera alone or aloe vera along with tea tree oil is a good combination to be used on the face we can use it. And then we can use oat scrubs and other scrubs on the face to remove the dead tissues. Then multani mitti pack can be used to exfoliate the skin. So any exfoliating agents that you can use, natural or dermatological, they can be useful. The only thing you have to keep in mind that these should not be irritating, they should not cause scar. Now, one thing very important is in acne. If you develop acne, do not scratch and pick your acne, because if you scratch your acne, they cause very bad scars, and those scars would always remain. These are the common home remedies that we can use for acne, and also weight management and diet is very important as we discussed. So decrease the refined sugars in your diet, take healthy proteins, take healthy fats, take a lot of vegetables, green vegetables, salads. That would be very helpful for your preventing acne. So we have discussed about the diet to prevent acne as I have discussed before. But there are few things that I would tell you, that as a dermatologist, if you go, what are the common things, or a skin doctor specialist, what would they be giving you to treat acne? So besides diet, which is, I said, decreasing your carbohydrates and increasing healthy fats and proteins and eating a lot of green vegetables, what a dermatologist would be prescribing would be some topical solutions, and usually these have got retinoids like teritoin, isoteritoin. So they are used. Adapalene is used. So these are retinoids are the mainstay for the topical treatment of the acne, that are now well established. Along with that, sometimes we give some topical antibiotics like clindamycin is given, or sometimes we are using Dapsone also as a topical antibiotic. Then some exfoliating agent like salicylic acid can be used because it will remove the dead tissue from the skin. And we can use some face washes also in the same manner to improve the quality of your skin. So these are few things that we can use on the face to improve the quality of your face and to prevent the formation of the acne. Sometimes if the acne are very severe and they are not responding to topical, then the oral antibiotics like doxycycline can be added to the whole thing, and sometimes we give isoteritoin and some other medicines also to decrease the acne formation. So all these things are like medical, and they have to be done under supervision of doctor, and they would be the right person to go to your doctor and ask that what medications are right for you for your acne management. But keep in touch and do not stop these medications if your acne respond. Sometimes we also give chemical peels like salicylic peel and mandelic peel along with these medications to help the acne to improve faster. So let the doctor decide this, and these are the procedures that can be added along with the treatment to improve the results. So thank you friends, we have taken up this topic, and if you have any questions you can ask them in the comment. We have made other videos also on various topics like hair transplantation, like vitiligo, rhinoplasty, gynecomastia. Please have a look at them, and if you have any queries or you want some more information, we can make those videos for you on those topics. Please write them in the comment box, and there are some WhatsApp numbers you can contact us. We have a team of doctors, dermatologists, plastic surgeons, cosmetic surgeons working together with us, and we can look into your issues and help you out. Thank you friends, hoping to see you sometime in future.